I'm Dr. Jim, and I have got a topic for you. Major depression, CBD, and the endocannabinoid system. This is absolutely amazing science. Full length article here for you if you're a reader. It's on my blog, drjimcollins.com. Thanks for watching the video, though. Share this with your friends, your colleagues, because major depression is a very serious form of depression. It carries a 15% suicide rate with it. Antidepressants may work, may not work. The individual may have a form of treatment-resistant depression. Understanding our endocannabinoid system, major depression, its characteristics, signs, and symptoms, and how CBD might help, I think needs some attention. So that's why I gave it some attention. I did the research, and now I want to share it with you. So major depression, often called Major Depressive Disorder, MDD for short, is one of the most common psychiatric disorders in the United States and, yes, around the world. The burden that it places on individuals' personal lives as well as caregivers can be really severe. Although there are both pharmacological and non-pharmacological treatments, there are medications and there are therapies, they're not always successful in symptom treatment or alleviation. It is therefore compelling to find an alternative therapeutic approach to major depression that will be better tolerated, safe, and effective. And that's why I wrote this. What is major depressive disorder, or MDD? MDD is a psychiatric condition characterized by persistent and troubling symptoms, including the following: feelings of sadness, hopelessness, loss of interest in activities one used to really enjoy, changes in appetite and sleep, feelings of worthlessness, difficulty concentrating, recurrent thoughts of death, and suicidal actions. MDD is a terribly debilitating illness that affects the individual's physical, mental, emotional, social, and occupational or academic life. Globally, it affects a lot. Simply, everyday tasks like cleaning the house, running errands, paying bills, washing your car, they become very challenging to perform. And the individual may feel like they just don't have the energy or the focus to do it. So small tasks become monumental. Unfortunately, the condition is also highly associated with suicide, and according to the CDC, there is a completed suicide in the United States every 11 minutes. It's a terrible statistic. So let's talk about the pathogenesis of depression. One way to grasp the underlying physiological mechanisms of suicide is to examine pathophysiological models of major depressive disorder. One such pathway involves monoamine neurotransmitters, including serotonin, noradrenaline, and dopamine. Simply put, it has been believed for some time that these neurotransmitters play a major role in suicidal thoughts and actions. The stress-sensitive hypothalamic pituitary adrenal axis, or the HPA axis, it's like a bundle of nerves, a cable of neurotransmitters that runs down the center of the brain, is loaded with neurotransmitters, neurons, that might be the culprit of depression, suicide, and so on and so forth. This is another area of concern regarding the development of depression and suicidal thoughts and or actions. According to one article, chronic HPA axis dysfunction has been observed in 40 to 60% of patients subject to chronic stress, leading to sustained cortisol release decreased rhythmicity, and insufficient glucocorticoid receptor regulatory feedback inhibition. That's a lot of fancy words, meaning the severity of depression may be the result of high and sustained cortisol levels. I write about cortisol levels in another article and in another video about adrenal fatigue. Check that out at drjimcollins.com. Another more recent concept, the neuroinflammation hypothesis. This suggests that due to the imbalance between pro-inflammatory and anti-inflammatory cytokines, dysfunction occurs in the immune system, which then results in the gradual development of depression. Now, in the title, I alluded to the endocannabinoid system. There is a connection between depression and our endocannabinoid system. All humans, all animals on the planet possess an endocannabinoid system, or an ECS for short, which not only regulates most bodily functions, but is deeply involved in neurological pathways like the HPA, neurotransmitters, and other important systems outside of the ECS, the endocannabinoid system. Here's a quote from a study I read. Research indicates that the endocannabinoid system significantly contributes to the development and the etiology of depression, end of quote. Moreover, the ECS influences cognitive function, motivation, emotional response, sleep quality, and the stress response. So, CBD, the endocannabinoid system, and depression. What's the connection? Research has discovered various effects of CBD within the endocannabinoid system and their combined effects on depression in both animal studies, which are preclinical studies, and human studies, which are clinical studies. Experiments performed over the last 40 years on animals have shown CBD's anxiolytic or anti-anxiety and antidepressant results. One study reported that, quote, the evidence indicates a comparable effect between CBD and some antidepressants in a single or combined administration. And they were looking at fluoxetine or dysparame, modulating serotonergic pathways dependent on 5-HT1A receptor activation, end of quote. What that means is the researchers were looking at CBD and one particular antidepressant, or two different antidepressants, and they found very comparable results. CBD has antidepressant qualities, according to animal research. What about human research? In human clinical trials, the use of FDA-approved cannabinoid-based medication, Sativex, which I talk about in another article and video, was tested in a double-blind randomized study in patients with chronic pain. The medication not only significantly reduced pain, but it improved mood as well. Results of another study showed that daily oral administration of CBD can induce restorative effects of areas of the brain, thereby reducing depressive and psychotic symptoms in regular cannabis users. Other research-based effects of CBD and its interaction within the ECS on depression include the following. We saw reduced depressive symptoms, an improvement in attention, enhanced verbal learning, and enhanced memory. So here are my final thoughts on this particular topic, and there's a lot here. Among the many neuropsychiatric disorders out there, and there are plenty, major depression, or MDD, is one of the most debilitating conditions associated with many negative symptoms, lower quality of life, and an increased risk of suicide. Despite current modalities of treatments, both medication-based as well as psychotherapeutic, counseling and therapy, many individuals don't respond well to these medications or treatments. Some actually experience worsening symptoms, and others might start self-medicating, turning to substances to reduce their pain and their suffering, physically and mentally. It is therefore imperative, it's important, and I feel a sense of urgency in this area, to continue research on CBD and the endocannabinoid system to find very specific molecular and neuropathway targets that respond and reduce symptoms of major depression and other neuropsychiatric conditions. So I've got some references here for you too. If you take a look at the article, I'm basing this purely off of science, off of research that's being done here in the United States and around the world. So there you have it, my topic today, major depression, CBD, and the endocannabinoid system. I'm Dr. Jim Collins. I thank you for your time and attention, and I hope you got something out of this. Please share it with other people and keep coming back for more interesting information. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you, you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com, or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.